Do you have a child who is a picky eater? Maybe the child has a diagnosis of autism or a speech delay, or maybe they're totally typically developing, but having picky eating. Today, we are covering 7 tips for picky eaters for both parents and professionals. So I hope you love it. And before we get into the content, I also wanted to let you know that we tweaked the title of our podcast name once again. We've gone from the Turn Autism Around podcast for 275 episodes and only a couple handfuls of the podcast known as Positive Toddler Parenting. And we are changing our name one final time to Autism and Speech Delays Made Easy. And I think we're going to settle in on this title for a lot of reasons, mostly based on the data of what we were seeing in terms of views and shares. And we want to get this information out to the world, but mostly our information is going to help parents and professionals helping kids with autism and or speech delays. But again, all of this information works for all children. So feel free to share this information with anyone and everyone who is having struggles with picky eating. So let's get into the tips, the 7 tips for picky eaters now. Before we get into the 7 tips, I just want to give a disclaimer. Everything I say in the podcast, in my online course, even in my new high touch coaching program, everything I say is for informational purposes only, because I am not meeting children, doing in-depth assessments, and really being a big part of a child's program. I'm not a child's consultant. We don't have a patient provider or client provider relationship. So everything I say here is for informational purposes only. And with eating and eating issues, we can also get into trouble with taking little tips and tricks for kids with serious issues, serious chewing, swallowing, choking, malnourishment issues. So I do want to say that if you have any thoughts that your child may have a more serious picky eating issue, including all of those things I just described, or malnourishment, failure to thrive, we do want to recommend a medical evaluation. And these tips will help you, whether it's serious or not, to do an assessment and get a plan, which is part of picky eating tip number 1. But I just do want to say that everything I say here is just really to try to get the word out for common sense strategies. So let's get into picky eater tip number 1. So the 4-step Barbera method is the first step is always start with an assessment. So we want to do an assessment of picky eating and feeding issues as our number 1 tip. We do have a newly updated digital assessment, which is still free. Tens of thousands of parents and professionals have now taken it. So join them. It's called the Barbera Early Childhood Assessment, or shortened form is Becca. It'll take 10 minutes to complete. You'll get an assessment in terms of self-care daily activities, including picky eating, looking at whether the child uses utensils, whether the child is still using a pacifier or a bottle, can drink out of a sippy cup or an open cup or a straw, and whether they have problems with food selectivity or picky eating. That is a big chunk of the self-care part of the Becca assessment. You'll also get scores. Besides in self-care, you'll get scores in language and scores in problem behavior, and that can really help you get going in the right direction. Once you have the Becca assessment done, and we can link the link for that in the show notes here, the next big assessment you're going to want to do, which we're still on tip number 1, is you're going to want to get a loose leaf or a little booklet or a Word document, and you're going to want to keep track of everything your child eats for 3 days. So if it's 10 Lay's chips, if it's 4 ounces of 2% milk, we want to write down everything they're eating and drinking throughout the day for 3 days. And we want to be as specific as possible. This being specific will help you calculate, or your child's doctor or nutritionist, they can then calculate and get an approximate calorie intake. And it'll also give professionals clues, whether it could be something more serious if you are getting, 500 calories versus you're getting 1,000 calories or 1,500 calories. It also can give you clues if you're drinking apple juice throughout the day, then you probably don't have a vitamin C deficiency, for instance. So what you're eating and drinking, not just calories, but also can give you an idea whether, there might even be something more rare going on, like scurvy or rickets, which are certain vitamin deficiencies from lack of nutrients. So you want to do this 3-day food diary, and that is our tip number 1. Do the Becca, do the 3-day food diary. So let's talk before we move on to tip number 2 about, is it just picky eating or is it something more serious like failure to thrive? So, or is this extreme picky eating a part of autism? So I didn't know this until I wrote my latest book, Turn Autism Around, that extreme picky eating and other food issues actually are much more common in kids who get a diagnosis of autism. Many kids without autism are picky eaters, including both of my kids. My son Lucas, who has autism, was a picky eater, but also was my son Spencer. He was a picky eater too, and he's typically developing, ended up to be gifted, and is now a physician. So no worries. It doesn't mean that it is, definitely going to be autism if you have a picky eater. So my son Lucas had severe eating issues. He was full term and he was normal weight until he became so picky that he started to eat not just chicken and fries, but he'd eat the edges of chicken nuggets. He'd eat only certain French fries, like from a fast food restaurant. He would eat corn chips and bread, but his weight started to fall on his growth curve. And around the age of 4.5, he was diagnosed with failure to thrive because his growth curve for weight was not accelerating at the same rate as should. So so you might be asking, what is failure to thrive? So according to Hopkins Medicine, and we can link that in the show notes, failure to thrive is when a child's weight, height, and head circumference do not accelerate like same-age peers. So the child's weight falls lower than the 3rd percentile, as outlined in the growth curve charts, or 20% below ideal weight for their height. So Lucas at that point was very thin, and his height was normal. And because of his failure to thrive and extreme picky eating, he was diagnosed with a feeding disorder at the age of 4, in addition to his diagnosis of moderate to severe autism when he was 3. So he was referred to an outpatient feeding program at the Children's Hospital in Philadelphia. And we went back and forth, and Philadelphia is about an hour and a half from my house. So we went back and forth each day driving for the 10-page out, 10 we attended a 10-day outpatient feeding program. So Monday through Friday, I would drive down, we would do the program, and I would drive home. And there they treated his picky eating. and his feeding disorder. And they did so pretty successfully. But since I became a behavior analyst in 2003, I've had a lot of former clients with picky eating and some with pretty serious eating disorders as well. And this was a catalyst for me to get more training in this important area. I had one client, I'll call him Zach. He was 6 years old at the time, and I only saw him at school. He had some basic learning, early learner skills. He could mand, he had some imitation, he knew his body parts, he was potty trained. And I saw him eat chips, corn chips, and French fries at school. So his mom came in, she wanted to meet with me after school, and we were going over some of the issues that they were having at home. So when I asked about his feeding and his eating and his food intake, she told me that he was eating, um, corn chips and French fries and those sorts of things, the things I knew he was able to eat. And then I asked her, well, does he get any, fruits or vegetables or even any protein or meats? Um, and she casually said, now remember, this child was 6 years of age. She casually said that, well, he only gets that stuff, fruits, vegetables, and protein in the baby food that I give him. And I remember thinking, baby food, that's interesting. He could chew and swallow, and I knew that was fine. So when I asked mom about Zach, how many jars of baby food does he eat? She said about 52 jars of baby food a week. And she had just got done really venting about how they were having money issues, that the dad was in the service and he was abroad fighting a war, and mom was at home with these two boys, one with autism, and that, he still wasn't potty trained. So that was an expense. And now we've got the feeding, 52 jars of baby food. I haven't been in the market for baby food for a while, but I can't imagine that's inexpensive. So there is a child that we don't know has significant feeding issues unless we ask. I've also had several 2-year-old clients over the years with problematic eating. One boy ate gluten-free crackers and drank almond milk out of a bottle morning, noon, and night. That's it, except for if they would go through McDonald's and get French fries. So that was it. That's all he ate. And another 2-year-old boy who was okay with finger foods, but screamed with anything mushy, screamed when utensils were presented. And so a lot of people get paralyzed with what to feed kids when if they become picky, let alone extremely picky. So let's get into picky eater tip number 2. It is actually another assessment. But it's a very easy assessment that you can do. It's called the Easy, Medium, Difficult Food List. And you can get a form and a sample from my free book resources at turnautismaround.com, or you can just get out a piece of paper, and make yourself your own list, right now. So what you want to do is you want to take a piece of paper or the actual form and make 3 columns. The first column we label easy, the second column we label medium, and the third column we label difficult. In the first column, we want to write down any foods your child eats, with it willingly. So, and some of this food, maybe most of the food, will be more junk food. Like they'll eat corn chips, they'll eat French fries, they'll eat chicken nuggets, or they'll eat the edges of chicken nuggets, or they'll eat white macaroni and cheese, or they'll eat blueberries. Whatever the situation is, you want to write that down in the easy column. The next column, the middle column, is the medium foods. This is foods that the child will eat or has eaten pretty recently in the last month or two, but sometimes there's a problem. So while white macaroni and cheese may be in the easy column, maybe yellow macaroni and cheese or different kind of French fries are in the medium column. And that might be foods that the child will eat if there's no other options, if they're really hungry, if they're in a good mood, whatever the situation. So and then the difficult foods are foods that are off the table, no pun intended. They are very difficult for the child to eat, and there's lots of refusal, crying, whining. Those foods might be fruits, vegetables, protein, meats, mushy foods, crunchy foods, whatever the situation is, those go into the difficult foods. So once you do that, you want to, once you do that assessment, the easy, medium, difficult food list, for now, I would encourage you to start feeding your child more easy foods at mealtime, and maybe weave in some medium foods if it doesn't cause any distress. But children crying during meal times, really could also lead to choking. And so we really want to get meals at tables and meals or foods to be calm and no problem behavior. So you may have to really go back to your easy foods and really take your difficult foods out of the mix for now. While you're assessing your easy, medium, difficult food for your child, you'll also want to assess what they're drinking and what they're drinking from. So if they're drinking apple juice versus milk versus water, that'll differ in terms of calories and also nutrients. If they're drinking out of a spill-proof sippy cup versus a straw versus an open cup, you are also going to be able to see if there's no fruits and vegetables, for instance, in the easy or medium columns. You'll be able to quickly assess food groups that may be missing. It's also important to assess any mouthing of objects or inedible things, or a disorder called pica, which is when kids eat inedible foods. So all babies mouth objects that aren't edible, but excessive mouthing and chewing of objects after infancy can be a medical issue, and it could also indicate that there's some vitamin or mineral deficiency or excess. We had a TikTok autism influencer named Zulika on the podcast back in episodes 201 and 202. And we talked a lot about, we can link those in the show notes. We talked a lot in those interviews about her son, who was 4 years old at the time, with his excessive chewing, mouthing, and pica. I've done podcasts on all three of those things too. We can link as well. But after the podcast interview, before the show even aired, Zulika, upon my encouragement of, hey, excessive mouthing and putting everything in his mouth at 4 years of age, that is really not a normal thing. And you can't blame that on autism. There seems like there might be a medical issue. And so I encouraged her to see her healthcare practitioner and get blood work done. So she did. She actually took her 4-year-old and her 2-year-old with speech delays to a physician, to their pediatrician, and asked them to test for things like lead, iron, zinc, magnesium, copper. And she did. And what she found, and she posted on TikTok right away, that within days of that interview, she found that both of her kids, her 4-year-old with severe autism and her 2-year-old with speech delays, both had very high lead levels, to the point where the health department came in and she had to make drastic changes to their diets, to their environment, to get both of her boys to be healthier and her 4-year-old to stop chewing excessively. So, as I said, the pica of actually swallowing inedible things, like kids can swallow mulch or rocks or even glass, and this obviously can be a very life-threatening self-injurious behavior. So if your child is swallowing inedible things, it is a serious issue, and you should call and make a sick appointment with your physician, your child's physician, to discuss that. So one of the things I learned when I was writing Turn Autism Around, specifically the chapter 10 on picky eating, and I learned this from Dr. Keith Williams, who we did a really popular podcast episode on. Dr. Keith Williams is a doctoral level behavior analyst, and he's an international feeding expert. We can link his interview in the show notes. But he told me about a 2019 study that was done by Mays and Zikgraf, suggesting that atypical eating, including severely limited food preferences and refusal of different textured foods, occur in 70% of children with autism, which is 15 times more common than in typically developing kids. So, and the study also showed that in children as young as 1, extreme picky eating and other feeding issues can be a diagnostic indicator for autism, as kids with ASD are far pickier than children with other developmental disorders. One of the things that Lucas and Zach and the 2-year-olds I talked about had in common were they were all diagnosed with autism. But I've also had my typically developing son, Spencer, who was a picky eater. Like, these tips work no matter what. But if you do have extreme picky eating, especially early on, without an autism diagnosis, you're definitely going to want to dive into more information about feeding and try to turn feeding issues around as soon as possible. Both the 2-year-olds I mentioned, the boy with the bottle and the gluten-free crackers, and the boy who couldn't tolerate anything mushy on a spoon, were both completely not talking. They were nonverbal or non-vocal. So one of the things I find is that kids with severe feeding problems usually have talking problems too. So it's important that you learn how to help your child or clients eat better and drink out of open cups and straws, and progress to utensils and to crunchy food, and tolerate mushy food, tolerate and use utensils. And by improving the feeding, you can also, in a lot of situations, improve the speech skills, the language skills, and reduce problem behaviors across the board too. All right, let's move into picky eating. Tip number 3. And this is for all kids and even ourselves. We need to stop letting them graze all day and stop in between snacking. Stop giving them, like, making a meal, then they refuse, then you're like, okay, I'll just make them a peanut butter and jelly sandwich, or I'll give them 2 bowls of Cheerios to walk around the room because I know they didn't really eat breakfast. We really should encourage the child to eat all snacks and meals at a table. I would avoid having them sit on the sofa, like I said, eating while walking around. There's an article from healthychildren.org, which we can link in the show notes, which says, gives you some ideas about making mealtime fun and including kids in meal planning and cooking whenever possible, and getting them more involved with meal prep, I think, is a great idea. We always want to pair eating at a table and with things the child likes, to use the easy foods instead of trying to battle it out and present difficult foods at this point is probably not wise. You also might want to bring other reinforcement at the table that's not food related, like action figures, or even watching a video on a tablet while you are giving bites of food, or while they're sitting calmly and eating nicely. You can also arrange food in creative ways, different shapes that the kids might recognize or find appealing. And you can also make smoothies. to get in some of those nutrients that might be missing, at least for a while. Some kids like dips and condiments. Some kids, like my son Lucas, does not like that kind of thing. But if they do, you can also get some nutrients in those things. And try cutting up solid foods into bite-sized pieces so that they can eat them themselves and eliminate frustration. So that was tip number 3. I think that's really important to have them sitting and enjoying meals and snacks and not letting them graze all day. Strategy for picky eaters number 4 is to switch snacks or meals to increase nutrients as much as possible. So obviously 1 cup of vegetables would have more vitamins and nutrients than 2 cookies. So if the child has any vegetables or fruits on the easy list, like I gave the example of maybe your child likes blueberries, but that's the only fruit that they eat or tolerate at this point. We want to be offering blueberries maybe at a few meals, maybe during snacks. Maybe we could try things that are like blueberries, or maybe we could try blueberry yogurt or blueberries in yogurt to try to pair those kind of things. But the more nutrients we can get in, the better. Picky eater strategy number 5 is we want to limit snacks in between meals, especially 1 hour before and 1 hour after meals. So, and even if you're going to give snacks, like I said, they should be at the table. So, if kids are eating snacks too close to meal times or getting edibles in some way, they're not going to be that hungry. As I said, both my boys were picky eaters. And I remember Spencer when he was, I don't know, 12 or 13, he went to some Boy Scout camp and they only gave them like an apple in the morning and maybe they had to make an egg or something. And then by, 6 hours later, they served like pot roast or something. And I thought, there's no way Spencer would eat pot roast. But he was telling me about the trip afterwards. And he's like, and I said, well, what did you have for dinner? And he's like, pot roast. And I'm like, and you ate it? He's like, it's surprising how good food tastes when you're really hungry. And I think in a lot of ways, we don't let our kids get a little bit hungry so that they're tolerating and liking some medium foods. Like it, don't forget about the calories too. And this, we're moving into picky eating tip number 6. Don't forget about these calories in juice and milk, and in other liquids either. I encourage you to give water throughout the day. It's less messy. Kids should have access to water all the time, but juices and milks will add up with the calories and make kids, in a lot of situations, less interested in foods, especially trying new foods. So I would limit juice or milk to serve with meals or snacks in regular cups or cups with straws. We really have to get away from, definitely from bottles, but also from spill-proof sippy cups, which really are not great for articulation. We want to really eliminate, if possible, sippy cups, bottles, and pacifiers. And it may be necessary to do that in order to get a child to eat and drink better. I did a video blog we can link about weaning from pacifiers and bottles, and I also have a weaning 6-step check sheet you can get at marybarbera.com/wean. We will link that in the show notes as well. And our final tip for picky eaters, picky eating tip number 7, is to, once you get the child sitting at the table, eating easy foods, it's important to start presenting medium foods in between easy foods, and then eventually weave in some harder foods when it's appropriate. But if you push too far and the child starts whining, crying, having fits, you've probably gone too far. And remember, if it's something more serious and you're having a lot of feeding issues, you're probably going to want to get a professional help in terms of a behavioral feeding program, at least visiting your physician, maybe seeing a nutritionist and getting some help. So in summary, there are 3 feeding assessments you can do today: the Becca digital assessment, the 3-day food diary, and creating an easy, medium, and hard, difficult food list. We want to have all meals and snacks and drinks with calories except for water at a table, making snacks and meals as nutritious as possible, and working with your child to ease in more medium and more difficult foods along the way. But remember, if your child is having eating problems, he might also be having issues with talking, following directions, imitation, play, and might be having a lot of problem behaviors too. So all of this needs to be addressed. The Becca assessment, the digital assessment that is still free. I don't know how much longer it's going to be free, so you want to check that out. Get a handle on all of your child's strengths and needs and start taking action. Chapter 10 of Turn Autism Around, the book, and joining our online toddler and preschooler course would also be worthwhile, especially if your child has a diagnosis of autism or speech delays and has feeding issues too. I would love it if you share this episode with anyone who would benefit, who has picky eaters, who wants to make some changes. These tips should work for all kids, and I hope that I see you right here next time for another episode of Autism and Speech Delays Made Easy.